You don't get over an addiction by stopping using. You recover by creating a new life where it's easier for you not to use. If you don't create a new life, then all the factors that brought you to your addiction will catch up with you again. That really hits home. This is Collateral Damage, addiction, recovery, and all the shit in between. So let's get real. Let's get raw. Now your host, Brandy Mack.
Hey everyone, I know it's been a while. I apologize. Shit happens, and that's all really I can say. At this point, weekly podcasts are probably unrealistic with my schedule, so let's aim for bi-weekly. Anyways, what I wanted to bring you tonight was the topic of bodybrokers. Maybe some of you have heard what this is, or maybe you're familiar with the term the Florida Shuffle. The Florida Shuffle is basically people who get caught up in the corruption of the rehab system due to the fact that they have private insurance, which is kind of like their golden ticket. And these facilities have people they hire and pay cash to, which is the body broker, who help these people come in. They test positive on a drug screen. They go through treatment. And when they're up, say, for discharge, they take these people out, put them in a hotel room for a weekend, give them heroin, give them drugs, let them party it up, throw some Narcan their way, throw some cash their way to have them go right back to that treatment facility or a different one and start the cycle all over again. How fucking corrupt is that? This is something that actually took place. It was very prominent back, I know, but with oxycontin when all that shit happened and so many people needing to seek treatment. But really it started with when the Affordable Care Act came into play. What the Affordable Care Act did was it required private insurance companies to cover mental health and addiction treatment. That was something that was not required before that. Something else it did was it allowed parents to keep their children on their insurance policies up until the age of 26. So with these new stipulations and it being required for mental health and addiction medicine to be covered, the rehab system flourished. Thousands and thousands of rehabs opened once the Affordable Care Act came into play. And we're not talking about physicians going and opening these treatment centers. Many of the people who open these, they're backed up by investors. Who knows how corrupted the investors are? And they're people who battled addiction themselves. And they're opening these facilities with shady practices. And the most disturbing part about the fact that this goes on is you would have no idea that this was happening at a facility if you just looked at their website or you spoke to somebody over the phone about it. They're going to seem perfect. They're going to seem like the best place to be because you're talking about sales pitches that just feed on to the emotional heartbreak of loved ones who are trying to get their loved one into treatment. You know, you just want to get them there. And I've been there. And I believe this corruption is still very much taking place in the system. I just think that they found maybe different ways to do it, or people just aren't paying as much attention to it. The rehab system has very little oversight when you compare it to, say, hospitals and what doctors and these other facilities have to go through in order to still keep their doors open. If a hospital continuously has, say, low success rates, right? They're going to get the reimbursement cut. That doesn't happen with rehab facilities, okay? We're talking about what? Probably less than 10% success rate across the board when it comes to recovery. That number can range anywhere from 10 to 20% depending on the study you read, but those still are very low success rates, especially considering that many of these programs are their program is based off of 12 steps. And 12 steps came out in the 1930s, yet these facilities continue to use these programs that really are not working. So, you know, one thing we constantly promote right or here is that relapses are a part of recovery. And what's interesting in one of these articles that I read, it said relapses are obstacles on the road to recovery. But for rehab owners and brokers who make money each time a patient is admitted, relapses can be a profit center. And how true is that statement? I mean, why? I mean, we live in let's take just healthcare in general. Our system is very broken. Our system wants to keep people sick in many ways, wants them to be dependent on a pill, on a medication, because Big Pharma has their hands in the pot. Everybody wants a piece. This is why I know many will disagree. I really support the idea of universal health care because I think everyone is entitled to health care. And I think if we were to go to universal health care, I think you would be able to eliminate a lot of the fraudulent activity that is happening in our healthcare system. It's just really disturbing. I mean, one of the numbers I saw that came out was that when the Affordable Care Act actually came into play, it was the first year over $700 million in insurance reimbursements. The first year. I mean, we know that there is a huge opioid epidemic taking place. And now we have this endless amount of treatment facilities, beds full at these treatment facilities. Yet, how are our overdose numbers going up? The amount of people getting addicted continues to increase. Yet, the treatment industry is somehow making a profit, and nobody is questioning why most of our facilities are not even doing evidence-based practice. All of these programs tend to be focused on 12 steps. And I have nothing against 12 steps. Like I said, I think 12 steps can be really great for some people, but it's not meant for everyone. Addiction is not the same now than it was back in the 1930s when that program was formed. It is just, we need change. We need more studies to be done on what is going to work. And I talked about this in one of my recent videos, as I question sometimes how effective is treatment. Statistically, the numbers that are out that we do know, it's anywhere from like 8% to 20%, 20 at max for success rate. Those are very low numbers considering the amount of facilities that are out. I have seen some facilities, when you go on their website, they try to fucking claim a 95% success rate. You are full of shit. If those numbers existed, we wouldn't have as many people fucking overdosing as we do in our country. It is just unbelievable, the bullshit that gets spewed. Realistically, when you think about it, right, when the oxycontin epidemic kind of happened and Big Pharma was the bad guy and, doctors were the bad guys because they got all these people addicted to oxycontin, and the claim was that it was non-addictive. Surprise, it was super addictive. This is how corrupt the system is. And so then all these pill mills opened, right? And now all those pill mills have been closed down, and they went to one extreme to a complete opposite, to now people can't even get their actual acute pain treated appropriately. And now there's all this additional stigma. So basically, what happened was Big Pharma was the bad guy, but now we've transitioned to where a lot of these rehabs are the new pill mills. It's just additional fraudulent activity. It's people taking advantage of a vulnerable population. When a lot of these people enter treatment, they do want to get better. Nobody picks to be homeless and live on the streets. Nobody picks to, use their body to get drugs, to steal, to rob from their families. That is not a decision majority of society would pick in their right mind, and that includes people who battle substance use disorder. It changes them. I have seen my daughter, I have communicated with her when she has been in active use and when she is sober, and there is a significant difference in the person. They're no longer themselves. And then we have this huge stigma that is created. And because of the pain that families are caused, I think a lot of rehabs use that. They use that to keep the families away so that this population can be continuously taken advantage of. And many don't really want families involved that much. That was my experience. I literally was in a blackout period for over 90 days. And I kept asking, well, why? I couldn't get a fucking reason. And my thing is, that's fine. If there is a legitimate reason why a 90-day blackout period is necessary, I will understand that. But their policy, like in what the paperwork was signed, what was promoted to us before we picked a facility, was that their blackout period was 30 days, 45 days max. 90 days later, I was still in a blackout period. It just made no sense. And a lot of the reasonings that I found out that were used was because the interventionist who was involved that I never hired was publicly stating on his TikTok platform was that, I was toxic. And I was like, oh, that's the first time I've heard about that, because I asked the facility to tell me. If it was a thought that my daughter didn't want to communicate with me, if that's what she said, and I would have been fine with that. But I was still allowed to get all this information. That was not the case. They were literally cutting us off from each other. And it was just very disturbing to me. And most people do not have blackout periods that long. I do agree that a blackout period probably in the first 30 days is necessary. I think because it helps eliminate the cell phone. It eliminates those outside influences when you're, going through detox and you're starting to get to know the people who are in your group. I mean, I can see why there are positives to a blackout period. But when a facility can't even answer a question appropriately or honestly as to why there's this blackout period, I have an issue with that. I'm more than willing. If you want to say that I'm the problem and that's why there's a blackout period, okay, then just tell me that. I'm not going to get butthurt about it. I mean, Lord knows, I've been going through this shit long enough. I know I'm not perfect. I know I made a lot of mistakes as a mom, and I'm not innocent in any of this, but I'll own that. And I always owned it. People get involved because maybe they're getting kickbacks from it. I think kickbacks still very much happen in this system. I think it's more of a money laundering thing that's going on. That's my theory, because you have to be sneakier about it because it's actually a felony due to the No Kickbacks Act. When all of this fraud was taking place between the rehab system and the rehab system, that now they had to get sneakier about it. Just like every other criminal, they find a way one way or another, and people are greedy and love money. And it's sad to me when it's not about the patient. These patients are not viewed as humans. They're viewed as money, as a dollar sign. And I think that this needs to stop. Many times what happens is you have these facilities, they take advantage of the fact that there's little oversight over these rehab systems. They're not required to have a physician on staff. These are not, imagine, what if we said, we're going to send you to a hospital and they have no physicians or nurses on staff? Would you want to go to that hospital? Probably not. And I know there are a lot of people that work in these treatment centers that they're in recovery and they become addiction coaches and they just want to make a difference and give back and help in some way. And I appreciate that. And the people who are corrupt are usually not. It's not people at that level. It's the upper level that you have to worry about. I had the owner of the facility my last daughter was at call me, and he only called me because of my social media platform and me speaking out loudly about it. And they were getting a lot of negative feedback and phone calls. He called me personally for the first time and acted concerned. And when I asked him, I said, I would really like it if you could send me your AMA policy, which is against medical advice, and your policy on patient belongings being returned. Because at this time, my daughter had been missing. And he literally told me, he said, I don't feel comfortable doing that since you're speaking out on social media. I asked for a policy. Okay. But they don't want to give you that information. Many rehabs don't even want to participate in studies. So we really don't know how low or how high the success rate is. There needs to be more oversight over this. We need real numbers. Hospitals are required to provide real data. Rehabs are not. There needs to be a scoring system, and it needs to be a third party who is administering these scoring systems, not rehabs doing it themselves, because of course they're going to skew the numbers. But who knows? Who knows how low the success rate of these facilities actually are. And I just really want to see some change. What else, I think I had touched on a little bit earlier, is the lack of evidence-based practice that's happening in these facilities that insurance is reimbursing on. Studies have shown that, MAT, medicated assisted treatments, one, they're FDA approved, and they have, when in place with like therapy, they produce better outcomes, better, longer sobriety time. People are able to stay off of opioids longer. I mean, the studies have proved this, yet many facilities are against it. I'll have many people on social media say MAT is not meant to be long-term. We don't really know that. Is that I hear too many stories of people who are, say, on Suboxone, and they're going to meetings, and there's this stigma at a lot of meetings. It really depends on the meetings. Some I hear are better than others, to where people guilt trip them. They make them feel like they're really not sober, that they're not in recovery because they're on medicated assisted treatment. That's wrong on so many levels. These people are no longer sticking a needle in their arm. They've maybe gotten their children back, or they're working towards that. They have a job. They are trying to do better, yet you're putting them down for doing that because they're not doing it your way. Those things should not be happening, and it happens all the time. When we were trying to pick a facility, one of the requirements was that we wanted her to be at a facility that was supportive of her continuing her Suboxone. That was a number one criteria. When we spoke to admissions, yes, no, that's not an issue. Not at all. As soon as she flew up there, got admitted, I'm eventually hearing from the therapist, because I couldn't speak to her, that she's weaning off of her Suboxone. And I'm like, what? That was never the agreement, because we would have sent her somewhere else. That's the reality. We would have sent her to a facility that was going to support her continuing on her Suboxone. But this facility completely flipped the narrative, because that's what they, a lot of these places will do. They get you in there and they lie to you. And I wish that I could tell you facilities that are honest and trustworthy, but I can't, because there is no scoring system in this country. There is no way to know based off of a website, based off of Google reviews. There is no way to know if they're a decent facility. Something else that's happened that is really messed up. So like in South Florida, there was this crackdown on all these rehab facilities, and all they do, they get shut down, and then they find other states that have laws that are not as strict, and they open up a treatment facility. Many of these rehab facilities will end up opening up their own urine testing labs, okay, so that they can bill insurance and collect all the money, right? So the rehab's collecting money, and then the lab's collecting money. It is just a fucked up system across the board. I don't really understand why insurance companies haven't done more or gotten more involved and pushed for, stronger oversight, because, they're getting robbed. And the thing is that when they're getting robbed of all this money for treatment, and because the system is being abused, the taxpayers are the ones having to pick up that bill. Okay, we're going to have higher premiums. We're going to have higher co-pays. We're going to have higher deductibles, because somebody has to pick up the bill and all the money that's going into the pockets of the owners of these treatment facilities. Something else I found interesting is that overbilling and patient brokering are found to be more common at out-of-network rehabs. How interesting is that? Because when they're out of network, they get higher reimbursement. Many places don't want to take Medicaid or Medicare because it's lower reimbursement. And you also you have stricter oversight anytime you're taking any type of federal money. So they'd prefer cash or out of network. let's talk dual diagnosis. Something else I found interesting was that when the Affordable Care Act came into play, they were not only required to cover addiction medicine via private insurance, but they were also required to cover mental health. So what happens? Now all these facilities are dual diagnosis, and it is not hard to become a dual diagnosis facility. I find it very interesting. My guess is they decided, let's go dual, because I bet they get higher reimbursement. And I would love it if somebody who works for an insurance company could confirm this for me. They have to get some type of higher reimbursement, because basically all of these facilities have gone dual enrollment. Now, I do believe that, yes, most should be dual enrollment, because mental health and addiction really do go hand in hand for many, especially trauma. I, however, believe the reason why all these facilities are doing dual diagnosis is because they get higher reimbursement. My daughter has gone to many different facilities, and some dual diagnosis facilities are way better than others. Some, it's just the bare minimum, and she never even gets started on a fucking medication. It'll get prescribed, but then she never fucking gets it. But guess what? Our insurance is still getting billed, right, for the mental health eval. But she never gets on the med. Shit like this happens all the fucking time. And it's just, it's just really frustrating. I feel bad for families. And maybe it's more frustrating for me because I am so aware. I have a better understanding of what takes place when it comes to the healthcare field and how billing works. Because, I have to bill as a provider, and it's frustrating because I got so confused. So I actually pulled up all of my insurance statements. I'm going to call insurance. And I want to get details on exactly how much the insurance company she's been to in the last 2 years, how much money has been reimbursed. I don't know what else, if there's a breakdown of statements, because when you look, it's not specific. It's really crazy kind of how these rehab facilities have billed insurance based off of what's on these statements that I can view. I want to see if I can get more details and be able to kind of present that data to you just based off of our experience, because it's so fucking confusing. I saw from the place she was at earlier this year, numerous doctor charges on one day, numerous. And I know that that's not real. She's not seeing multiple doctors. Now, I need to have that verified to me based off of that statement, but there are different codes for each of those charges, and they're all for the same date. And this happens multiple date. And it's just really confusing. I'm sure many of you have struggled with reading your insurance statements. And I'm going to be honest, I fucking ignored my insurance statements for the longest time. But now I am curious, how is this shit getting billed? And I'm just curious what the reimbursement rate is. Something I wanted to share, I got this off of the Department of Justice website. It's a July 7th from 2022 article that was written. It says, Addiction Treatment Facilities Medical Director sentenced in $112 million addiction treatment fraud scheme. $112 million, you guys, okay? This was a Florida doctor, and he actually got sentenced to 54 months in prison due to fraudulent billing, and it all had to do with substance use disorder. He basically would admit people for unnecessary detox services and bill for the most expensive kind of treatment the facilities could offer. This guy was also guilty of body brokering. He would hire brokers. He would give kickbacks for referrals. And, and these people were giving these patients illegal drugs so they would pop dirty for a drug screen to get admitted. Okay. This is the type of fraud that was happening. I see it all the time on social media. Actually, when I was looking for a facility a year and a half ago, a video got shared a bunch, and I had a bunch of large creators I had never heard of reach out to me. And the first question they would ask is, what's the insurance? What's her insurance? That's the first question. And I just want to be like, fuck you. Your first question to me is not about my daughter. It's what's her insurance? It just blows me away because so many people do not have insurance. Do they matter less? No, they don't, and they shouldn't. And I'm telling you, an influencer that has a bunch of followers, they're getting kickbacks, okay? They're getting compensated in some way for sending you to treatment. They may be getting paid cash under the table, but more than likely, they're getting kickbacks in some way. There's not a lot of people that do shit because, they have a kind soul and they want to help. No, money makes the world go round. You do have decent people out there, but a lot of these people, these big influencers, if that's what they're asking, what the first insurance is, and they're selling you on a place with a pool on the beach that looks beautiful online, I would question how honest they are being and what that system is like. It is another experience I had. I'm not going to say the name, but it was a guy that had been recommended to me numerous times. This was a few years ago, and he has actually been accused of body brokering. And I thought it was interesting because looking back at the conversations we had, I believe it. I knew less then than I know now about how this system seems to work. And, they had talked, like his assistant or whatnot talked basically about if they needed to give her drugs to get to treatment and, things like that. I'm like, looking back now, I'm like, wow, that is really fucked up. We never went that route. And it's just hard to trust people, you guys. And I'm sorry that this system is as broken as it is. I hope by me speaking on some of these topics that the right people will hear this and that some type of change can take place because something needs to happen. There needs to be more oversight. There needs to be evidence-based practice taking place in these facilities. If they're not, they need to be reported. They shouldn't be able to collect insurance money when their failure rates are so fucking high. Or they should have to prove their success rates. They don't even have to do that. I mean, why is insurance continuing to pay out reimbursement to places where people are continuously relapsing? I think that 30-day treatment is a waste for a lot of people. I think minimum in treatment should be 90 days. 30 days just isn't enough to get your head right to really be able to focus on therapy. And I've read studies, really 90 days to 6 months apparently there's higher success rates, which would make sense in many ways. I think having a supportive recovery community, I think that is important. And I can see where, say, meetings is important because you do get that sense of community. Otherwise, you're very alone. But there has to be change. There needs to be more studies taking place. There needs to be politicians getting more involved in this and taking care of this corruption. I think it'll eventually happen. I think there will be a crackdown, but I'm hoping it's going to be sooner than later. I hope people go to jail for some of the shit that they are doing when it comes to this system. But that is my rant for the night, you guys. And expect next week I will send out a newsletter. If you're not on the email list, I encourage you to join because I will not be spamming you, but you will get a notification when the next podcast is going to be released. And that will be an interview with Dr. Stacy Murphy, who actually owns Navigating Addiction. But until then, you guys take care and be blessed. Okay, so we've made it through another podcast episode, and if you like what you're listening to, how would you like to join my email list? What that's going to do is I'm going to start writing a newsletter. It's going to allow you to receive some of the more up-to-date information on addiction. I'm going to be putting reviews that people leave about the podcast on these newsletters. And it's also going to keep you informed on when new episodes release and upcoming people who will be getting interviewed. I'm currently lining those up, and so the link is going to be at the bottom at the notes section of the podcast, and I hope you'll join. I'm not going to be spamming you with tons of emails, but you're able to unsubscribe anytime, and it's been good. Take care.